Hi, I'm Dr. Stefana Pecher, the Country Doc. Welcome to our wonderful office located here in North Stonington. I'd like to introduce you to some very special guests today, dear friends of mine. We're very honored to have Dr. Kristine Schlichting and also Dr. Gwenn Rosenberg here with us to talk about a new collaboration that we've begun. Please go ahead, Chris.
Sure. So my name is Dr. Schlichting. I am the Director of Hopewell Health Solutions in Glastonbury, Connecticut. We are a psychology group practice of about 10 therapists. And I'm here today because we're talking about a collaborative effort of all of us working together, being sort of alternative providers and creating a new program called Wings of Wellness. So we're going to be rolling this out and explaining to you what kind of programs we're going to bring to you. They're going to be community-based programs that are open to the public, where you can learn about various topics such as trauma, mindfulness, different wellness-based topics, maybe nutrition. So we're still working on a schedule right now and trying to put that all together. So I want to just quickly tell you a little bit about what brings me here and what my passion is and what drives me every day. So it's been a long road for me coming to this place. I have worked and been involved in many different, had many different jobs throughout my lifetime, and I finally opened up a private practice about 3 years ago, and I really wanted to build a different model. So I was very, very frustrated with the traditional model of psychotherapy. And I developed a new model, which is called iTherapy, which is short-term based therapy, which gets people active and doing much better out in the world much more quickly. So, and my practice has grown substantially. It's been incredibly popular, and it's been a thrill for me watching people get better and watching the transformation. I'm so honored to be a part of people's transformation. And now we want to take some of those same tools of transformation that we know that work, that are highly effective, and bringing them out into the public. So, because I don't want people to have to come in to see me for every appointment. I certainly can't split myself 5,000 different ways and see everybody who could benefit from what we do. And so we're creating a platform to bring this information forward. So, and when I met Steph, I just knew that we were completely aligned with what we wanted to do, and has the same heart and passion and drive. And now we just want to take it one step further so it's more accessible to people at their fingertips and through their homes, right?
Yep.
Yeah.
Chris is definitely a guru, a technological whiz, and she's
trying.
She's bringing me out of the Stone Ages and hopefully into your homes and hearts.
Yes. By hook or by crook.
But what is really, truly wonderful is, this is exactly what I've envisioned and have developed over 10 years here in our wellness center. We not only combine traditional medicine with holistic modalities, but we also have some wonderful people we collaborate with, such as Gwenn, who's a naturopath. And we share a lot of patients and we take care of them in a holistic way. So we approach each person as an individual, and we look at them from all aspects, the psychological aspect, the medical traditional aspect, but also other ways that can really benefit their health and wellness. So we're very blessed to have this collaboration. And Gwenn, tell us a little bit more about some of the things you and I have done together, and about your own practice.
Absolutely, yeah. I'm so honored to be working with you both. Just really amazing women, and with such vision and strength and really leaders in the field. So, in terms of sharing patients, often, as a naturopathic doctor, I'm often referring people to all different types of doctors, but this is one of my favorite places to refer people to because I know they're so well cared for and so fully cared for. And really, I think that speaks to, medicine is the strongest when we can see each patient as an individual and think about what their specific needs are. And their specific needs might be to have surgery or to use a certain medication or to to see a psychologist, or and I think that really medicine works the best when we play as a team. And I think there's a lot of talk about playing as a team, but in actual practice, it hasn't quite happened. And so what I love about referring people here is often Dr. Pecher will call me and say, "Oh, that patient that you referred over, let's have a little chat. Let me catch. Let's talk about this." And, we can make sure we're working together. But,
and I'm always in awe of Gwenn because she has such complicated patients, and I say, how the heck did you manage this on your own for all those years? You are amazing.
Oh, thank you.
Very impressive. And
there is that. And I think that actually that's one of the things that happens in naturopathic medicine is that people often come who have very complex cases and who don't really fit into the sort of classic diagnostic categories. And so, they'll be told by doctors either, you're fine, your labs look fine, so you must be fine, or they're told, well, we don't actually, here's your diagnosis, but we don't really have many treatment options for that. And so, or they have a medication and maybe it doesn't work well for them, or they're not seeing you and they might not get the same kind of communication about their medication, because a lot of times I'm actually talking to people about why medication is actually the best treatment option available. And when I was working in Oregon, I could prescribe medications as well. But I think that those kind of complicated cases, I know they come here and they come also to my practice. Partially, I think because they know that they're going to be heard as themselves, and they're going to be really addressed as their own person and with their own medical history that can't fit into any one category. So I really see that you do that here as well. Take the time to spend with people. I think that that one patient you were mentioning, I think you were with her for an hour and a half. Sort of helping to dig through her case and figure out what was going on.
Well, yes, they need the time, and Kristine too, I'm sure you have the same thing, the same passion, and you give people the time they need.
Absolutely.
And you hear them out.
We're also embedded in a couple places, so some of the therapists in my practice are also working in medical offices, so they're embedded psychologists there, and we also have an embedded therapist over at Pratt & Whitney. So very much the push is to be where people are and to get help early on and to create an awareness about what the symptoms are and how to treat it early and get to it very, very early. And then, of course, collaborating with physicians, and naturopaths and whoever else is involved, and so everybody working as a team and coming together and really helping to move people forward. It is that holistic care that, the mind, body, spirit, right? You can't separate those. You have to treat the person as a whole, but you also probably need a number of different providers, to help put that person's life back together again. And a lot of times just one provider or one physician is not enough, that person really needs other people in their space to work as a team to really elevate them.
Yeah, and there's often so many barriers, between that referral that we might make to a mental health provider and them actually making it there. Whether it's insurance and I did work in a clinical setting where there was they had social workers and also psychologists on staff embedded in the clinic. It was phenomenal. So someone would come in and they might disclose to me that they recently experienced some trauma, or that they were interested in considering going into drug rehabilitation programs, or that they were interested in discontinuing their use of certain medications or drugs, or not medications but more drugs. And I could be like, oh, hey, would you like to talk to someone right now? And it was such a great moment because the person could just walk right into the room. If they wanted to, they could just say hello and kind of meet the person, so that it was really just a kind of a touch base. But sometimes they would choose to really stay there and continue that line of treatment. It's really amazing.
Yeah, and that's also why we're working on developing an online and Skype available option for patients, because we realize that it is very hard to get into the office, and that's a huge barrier. And there's also a stigma, though, as much as we try to break down the stigma and the barriers to treatment, there definitely is a barrier. So really trying to make it as easy as possible to get that first conversation going and get people some tools to get them getting better much more quickly. Because of course, if we wait until there's a crisis moment, there can be traumatic things that happen. but there's also a lot more work that has to be done than if we were able to step in much more quickly.
Yeah, and that telemedicine option
Yes.
is truly the way to go. And
Yes,
you know,
absolutely.
it's, despite my initial resistance, I'm now seeing that that's probably not only mandatory, but it's around the corner, and it's
Absolutely.
time to embrace it and really use it to help people, because there are so many people that can't make it in, live too far, their job's too busy, and how much more easy can it be than to see your doctor, your provider,
Right,
from the comfort of your own living room and privacy.
right. Absolutely, and establishing that relationship, and I think that's one of the things that we are looking to develop is how do you establish that relationship, and it might be something where the person comes in for an initial intake and you get some face-to-face with that person, and then you're able to sort of titrate back and do more like a 20-minute, teletherapy type of situation. But certainly, how can we change the model so that we're able to help people in a much more efficient manner, it's more convenient for people, and it also will ultimately be more affordable to treat people this way. And one thing we were also talking about is the importance of helping people right away when they need it. So teletherapy is going to be very instrumental in doing this, because it is going to make therapists much more accessible, where you don't actually have to come into the office, and I could actually work from home and call patients there and have some more hours throughout my day to be able to do that, to treat people, because when people need help, they really can't wait a month or 6 weeks or something like that, and then they can't wait another month to get an appointment. That's just really not acceptable.
Yep, that's
So,
exactly the same
get them the help that they
situation.
need when they need it. And also, how nice would it be if you're in a crisis, like, I'm just going to give a teenage example, right? Your boyfriend just broke up with you or something like that, and you need to talk to a therapist right away instead of having to wait a week, that you could call your therapist, or you could call and you could get some tools right then and there, and it's going to prevent people from doing things that they probably shouldn't be doing. So, or making mistakes, just sort of getting that ground underneath them again, in terms of checking in and getting them moving forward again. So so we're talking about technology and how we're going to make everything much more accessible. One of the big things that we're talking about changing the traditional model. We already are disruptors within our industries, so whether you like it or not. I definitely take that label. I love that label. Any day, anyhow, I'll take the mental health disruptor.
I've got that label. I've got it anyways.
All right, you got the label there. So we're definitely disrupting the traditional model, and then also what tools can we use to bring this great education and service and ideas forward? Because one thing we were talking about earlier too is that we end up within sessions or within your appointments saying the same thing 10 times. So this happens all the time, and people often think that they're incredibly unique. Well, yes, people are unique, but as providers, we do end up saying the same thing very, very much repeatedly, and we know how to extract sort of what's the formula, right? What's the basic formula for getting people to move forward, whether that's in the doctor's office, the naturopath's office, or the psychologist's office. So talking about trying to figure out how to get that secret formula and that recipe and create downloadable content or webinars or public access information, and then bringing it forward out into the community. And I think that's the next step that we're going to do in terms of Steph and I, and Gwenn, we'd love to have you too, is we're going to be doing on March 21st, Tuesday, March 21st, at 6 o'clock here at the Country Dock in Stonington. Hopewell Health Solutions, myself, and Erica Wilcox, we're going to be coming and doing a seminar on trauma treatment. And it's going to be a 2-hour workshop. We're going to be talking about the signs of trauma, different kinds of trauma treatment, what treatments work best for what kinds of trauma, who to see, when to see the person, and what to look for, what triggers are. So it's sort of a basic introduction into how do we treat trauma, what are things to look for, how do you even know if you've been traumatized, because one thing we notice a lot within our practice is that people come in and we'll talk about panic attacks, anxiety, depression, substance abuse, all these different things. And then when we dig deeper, we find out that there's trauma behind that, that's driving those behaviors. So oftentimes we don't even know what the effect is of that trauma. So it's really building that awareness. And the great news is that it's highly treatable. Trauma is highly treatable. So we're going to start there, but then we're just going to keep on going with this initiative.
I think that's absolutely wonderful, Kristine, and it really ties in to the whole heroin epidemic.
Absolutely.
And all the other problems that we're seeing, not just with young people, but with adults and just people feeling isolated and alone, and they don't know where to turn, and so they're turning to self-medication.
Yeah.
And I think that this will really help bring
Absolutely.
some awareness and hopefully, at least put some kind of a holding pattern on this mess that we're finding our community in.
Absolutely. Absolutely. So that is a lot of, and again, it starts early on. It's bringing an awareness of trauma, and also, and we'll probably do a whole section on just addiction and personality, because addiction and personality and genetics are very, very strong. And so if you know that about yourself early on, just like if you're genetically predisposed to, depression or diabetes or any of these chronic illnesses, addiction is also a chronic illness. So if it runs in your family and you build an awareness of, I have these kind of tendencies, there are very good ways to try to stay in the right path. But it is this sort of, we don't want to be blind to who we are, and building self-awareness, and then how do we stay within that path? What are the triggers? What are the things we need to look out for? And starting really early. So yeah, there's a lot of work for us to do.
Oh yes, never a shortage. Never a shortage of work. Oh. Well, what's really wonderful and unique too is that we are kind of breaking the traditional medical model just by dint of who we are, and that we're businesswomen as well, and we also are mothers. We all have children, and we not only run a business and take care of many, many thousands of patients, but we also take care of our children, our families, and so there's a lot going on here, and I think it'll be very nice for other people to see that it's not only possible, but it's definitely doable and enjoyable.
Yeah, absolutely. And that we're real people too, right? So I think that's a big piece in terms of personalized medicine. I really think often, especially as a psychologist, when you're looking for therapists, and I've gone to therapists myself, it's so hard to figure out who that person is and if you're going to trust that person. Same thing with your physician or your naturopathic doctor. You want to know who that person is. If you're going to be pouring yourself out to this person, if you're going to tell them everything that's going on with you, you want to feel comfortable and you want to feel like that this is a safe person that I can trust. So I also think a big piece of what we're doing is getting out there on the front lines and getting out in front of the camera so that people can see who we are as people, and really attach to that and, say this person is a real person too. She has something to say, or there's something that might fit with me from what she has to say. Instead of just being a blank slate, right? And what I find...
A big ego.
And a big ego. Yeah. So, I just feel like, I don't really understand why we're not out there a little more about who we are as people. I also find the more I'm out on either Facebook or social media or out in front of the camera and people see who I am, I attract the right kinds of clients, because people see me and they decide right away whether or not I'm going to be a good fit for them. And so the more you know about me, the better we'll figure out if we're a good fit for each other. So really, I think that's a piece of it too that we're sort of changing.
Yeah. Phenomenal.
Yeah.
Phenomenal.
Yeah.
Gwenn.
Gwen's like soaking it all in. I love it. Like, it's so good. It's so true. You really, like, when you think about how you usually find a provider, it's like, people are looking at insurance lists, and actually of any list of providers or professionals, an insurance list has like the least information possible. You don't get like, you might get where the person did their residency, you might get
where they're
how many
located.
years of practice, where they're located, right?
Yeah.
But and you're right. It's such a personal relationship. There's no perfect fit for every no physician, no provider is a perfect fit for everyone. And so really, we're all looking for to really the ideal thing is to have the right people find the fit, and not so much that like I know I wouldn't not for everyone.
Like Match.com.
Yeah, exactly. Swipe right.
Oh, that's Tinder, honey.
A little bit behind on the things. I love it.
We'll talk.
Up to speed.
Oh my goodness.
Yeah. But it's so true that really, to find a good fit, and for us to be people, and for people to know that, they're looking for someone who is going to be coming from the same place, because really to be able to provide good care to someone, there needs to be an understanding of you're on the same page.
A synergy.
Like really, and a really like an effort on the part of the provider to really to think about what that person is sitting in front of them, what's important to them, where they're coming
In
from.
conclusion,
And to treat
we'd like to say thank you very much to Dr. Kristine Schlichting of Hopewell Health Solutions, and also to Dr. Gwenn Rosenberg of Third Stone Health. Thank you guys very much for spending the time here with me in my office at the Country Dock in North Stonington. And Anessa Haney, thank you so much for filming us and for spending all of this time with us, all of your support. And we also wanted to wish you best of luck with your new cotton candy business. All right, take care and stay tuned. Follow us on Facebook, Twitter, and you'll be hearing a lot more from us soon. Thank you.
Bye, guys.